Welcome to Behind the Sports Medicine Podcast, the podcast that pulls back the curtain on the evolving world of sports science. I'm Andrew Rizza, an athlete trainer with decades of experience in professional, collegiate, and high school sports.
And I'm Cameron Roth, an orthopedic surgeon and a consultant for the Chicago White Sox.
In each episode, we'll explore the real-world challenges and opportunities facing today's human performance professionals.
Our hands-on experience is transforming sports medicine and breaking barriers through innovation and teamwork.
Hey, everybody. Welcome to this week's Behind the Sports Medicine Podcast. Today, we have Tremble, who is the Director of Medical Operations for the Miami Marlins. He oversees athlete health, performance support, rehabilitation, and return-to-play strategies across the organization. Corey, welcome to the show.
Oh, thanks, guys. Really happy to be here. Really excited to chop it up today.
Thanks, Corey.
Hey, Corey, so what does the role of Director of Medical Operations for the Miami Marlins look like on a day-to-day basis?
Sure. So, to be honest with you, I have a pretty unique role, even with against my counterparts throughout the league. There's a lot of teams out there that have a director of some type. It's either director of medical ops, director of medical services, director of athletic training or physical therapy. So none of them are created equal. That's the one thing that I've kind of noticed in our space right now. So ours is a little bit more unique. We at the Marlins have decided to go with a more vertical type approach to all of our departments. So every department has a director to it that kind of oversees everything from the major league staff all the way down through our Dominican Academy. So for my day-to-day, it's not player-facing anymore, which there are some challenges to that. Just being an athletic trainer at heart, I want to be working with players and all that kind of stuff. But with the shift in my career, it's become more of a day-to-day, how do I make the athletic trainers and physical therapists that I work with better? So how do I leverage them? How do I find out what makes them tick? What gets them to the next level? So that's really what my overarching position and focus is on a day-to-day. It's trying to make our clinicians better. It's trying to make better processes. It's trying to make better programs for all of us to have a really robust, strong department.
So that's really interesting because I was going to ask you, what are some of the challenges in keeping athletes healthy over 162 games during the season? But you're really in charge of keeping the staff
right,
healthy or on point or dialed in and working towards their best performance to help the athletes and the team. So what do you think are some of the biggest challenges in keeping the staff focused, dialed in maybe on some teams that are not as competitive as they should be, or just through a long season?
For sure. And you're not wrong. You're not wrong. That's really, we all try to elevate ourselves to these higher positions and all this kind of stuff. And we utilize what we've done in the past to try to say, hey, I'm going to do this. I'm going to implement this. I'm going to create this for the players to get better. But realistically, the way I look at it now is I've got an unbelievable band. And I'm just like kind of the band leader, the conductor of making sure that everybody gets their solo, everybody gets their time to play. And then that way we can have a much better song and a much better concert, right? So my goal is to take my unbelievably gifted, intelligent physical therapists and athletic trainers and give them the spotlight, give them the ability to really hone in on what they believe is really important, really give them the opportunity to have a voice and have a vision of what we should do as a department. And that's really what has in turn created like a better space for our athletes to get better. And really by having that as our focus, it's created better programming and processes because we're not all thinking the same. Everybody has their own ideas, everybody has their own visions, and we're all putting this in together, and then we're creating something from that. So I think that's what's been, the most rewarding for me as an athletic trainer and in this role as our director, but also it's what's really enhanced our programming and our processes because we aren't doing it just one way.
You build recovery plans, rehab protocols, return to sport timelines because you know outcomes don't happen by accident. Your financial life deserves the same intention. Bode is a fee-only fiduciary firm that starts with a plan. Your goals planning statement, a personalized roadmap that keeps your money aligned with where you're actually headed. Built around your life, backed by conviction. See what real planning looks like at beckbode.com. Looking to get back in the game and feel your absolute best? Boston Orthopedics and Wellness has you covered. At Boston Orthopedics and Wellness, they're all about helping you recover faster, re-energize your body, and truly revitalize your health. Whether you're dealing with an injury, looking for cutting-edge recovery therapies, or exploring innovative treatments for orthopedic conditions, their expert team is ready to guide you every step of the way. From advanced regenerative treatments like PRP, stem cell therapy, and peptides, to performance and wellness services like NAD+ therapy, men's health optimization, and weight management programs, they offer a comprehensive, personalized approach to getting you back to peak performance. This isn't just treatment. It's a path to moving better, feeling stronger, and living pain-free. Boston Orthopedics and Wellness is where your comeback starts. Mention Behind the Sports Medicine podcast to receive 15% off your first scheduled appointment. Learn more and start your journey today at bostonorthopedicandwellness.com. So run me through those discussions. Is this a vertical hierarchy where Corey Tremble, who used to work for the Tigers for a long time, says, I think this is in the best interest of the Marlins, or something comes from on high that goes to Corey, that goes down to the athletic trainers and physical therapists? Or is there a roundtable discussion where you say, okay, let's hear from the strength coach, let's hear from the athletic trainers, let's hear from the team doc, let's hear from the physical therapist, and collaborate? How exactly does that work, and how do you come up with your final product?
For sure. I think the short answer is yes, right? To all of those things. But I think the way that we've kind of structured this and how it's worked really well is, okay, there's a problem. There's a challenge. There's something at hand that we need to discuss. Okay, whether that be return to play for non-operative athletes. Okay, so we're looking at soft tissue injuries. We're looking at things that aren't going to the OR. How are we bringing them back? Are we just looking at a calendar? Are we just going based off a protocol? Are we just going off what the athlete says? So my job is really to take this subject that we have and just ask a ton of questions and not be biased in any way, or try not to be biased in any way towards a path that I hope that we go. And again, there's times where we have to pull back the reins and go, okay, come on, let's get back in here. Let's get back on focus. But a lot of the time it is an open forum for everybody to have a voice and have something to say about, we should add this, or we should take this out, or this is working, or this isn't working. And I think when you have that ability to have all of those voices to start with and give kind of some leadership and some ownership of a type of project or program, and say, hey, look, you're gonna run point on this. This is what we kind of want to do. And so we're now giving somebody else a little bit more autonomy with the ownership of a process. And then it just kind of trickles down from there. So I think that's the main focus of what we do. And then, of course, we always include our docs. We're always collaborating with our strength and conditioning, performance nutrition, our mental health and mental wellness groups, to make sure that we're always putting the player in the center of all of our decisions. And that's really what we do. So I think my role in this, when it goes well, is just to keep asking more and more questions, really dig in, really try to find out if this is the best way. And then and making sure that everybody understands at the end of it that whatever we roll out isn't in concrete. We can pivot, we can change, we can make modifications. And quite honest, we should. What we're doing right now shouldn't be what we're doing in 6 months, shouldn't be what we're doing in a year. We should be critically thinking all the time and dissecting what we're doing to see if this is the most efficient, this is the most effective. So that's really where this role kind of formulated for me, and why it's been so exciting for me is that that's exactly what we're trying to do. We're trying to say, hey, look, what are the questions we have to ask, and let's keep asking them.
We interviewed Brad Pearson, who's the director of sports medicine for the Red Sox, and he kind of said the same thing, trying to make sure that the entire staff is communicating with each other so you get the best possible outcome for your athletes and for the organization. That being said, where does communication with coaching staff come in when you're dealing with rehab and return to play decisions for these players?
Boy, communication, is that a problem anywhere? I mean, I always thought that, communication's easy, it's just picking up a phone and everybody understands it. I mean, it's difficult enough sometimes to get everybody speaking the same language on your own team, right? And your own medical staff, because a high grade is something to one person, a grade 3 is something to some person. So I think ultimately the first step was just trying to get everybody in sports medicine speaking the same language and on the same page. And I think we've done a pretty good job of that. We're never done with that. We're always, pushing each other to get better. But I think that was step number one. But step number two, I think, where a lot of sports medicine departments fail is this ego that they carry with them, that when a guy's injured, they're our player. And it's like, well, it's not really the best path forward, I think, for the return to play progressions. So yes, we are leveraging our pitching department anytime a pitcher gets hurt. We're leveraging our infield coaches, our hitting coaches every time things are going, and trying to utilize some of the, I would say, quote unquote, healthy training methods that we use with our healthy players. And how do we incorporate them into our rehabilitation for return to play? And I think that's where we've really grown as a sports medicine department, is starting to look into some of these different training models that are out there for athletes to get bigger, faster, stronger, and shifting the focus and changing the lens of how we utilize it and look at it, and utilizing it for our return to play players.
In your experience, what separates athletes who successfully return to play from injury versus ones that struggle?
Mm-hmm.
Does that have to do with the hierarchy or the communication? What seems to be the issue that you're dealing with?
Yeah, one of the things that you really start to focus on is when you start seeing the same thing day in and day out, like you just start focusing on only that. And I think that's where having some of these other coaches involved and having some of these other professionals involved can really start shining a different light on what's going on. And you might be thinking things are going really well, and that infield coach or that hitting coach would be like, well, you know what, he told me that, it's not going as well as we thought. So I think that's really important. And I think when things don't go well is when there's not trust with one of those departments with the player, or department to department, there's not trust. So I think that that's a big piece to it. But I also think there's a mental component that we do not give enough credit to, of that return to play for that athlete. Because you think about it, on top of it being their job, their livelihood, and that brings all the stress that does bring. But think about it in another regard of their sport is their coping mechanism. A lot of times our athletes go out there and they play, and that's to free themselves of their problems. And now we've taken that away from them. So I think leveraging the mental health aspect, and not just mental skills, but truly mental health aspect of the return to play progression and process, is really important and something that's really overlooked.
I mean, I love where you just went with the mental health. We'll get on that subject in a little bit. And I also love how you mentioned getting another set of eyes on a player. We talk about working in teams as professionals. Especially, I'm working in a physical therapy practice. I manage a team as a clinical director. I also work in the traditional setting. Cam works with a number of other surgeons and rehab specialists in his clinic. I think it's important for us to make sure that we're all playing the same way in the sandbox, all together and getting along. It's the benefit of the people we're treating, right? So again, you said it best. We see these things over and over and over again. And what are we missing that's making this athlete struggle? It's important for us to be a little bit humble, step back,
no doubt,
check your ego at the door, and then make that decision for the athlete. So I'm glad you said that. That's fantastic.
Yeah, no, I couldn't agree more. And that you only get there, you only start thinking that way when people that have given you their time, that know a lot more than you do, and kind of push you down that road. I think back to my relationship with two of the main doctors that have been in my life is Dr. Andrews and Dr. Meister. And, Dr. Meister obviously trained under Dr. Andrews. So a lot of that is just second nature for him to kind of continue to trumpet what Dr. Andrews said. But again, it's super important to understand, like, look, no matter how much money I have as an athletic trainer, I'm never going to be the richest guy in that room when an athlete's hurt, and there's a lot of smart people in the game now. There's a lot of things that are happening in the game that are way different than they were 20 years ago. So yeah, to think that you've got all the answers or that you've got everything figured out, boy, the minute that you think that is the minute that failure starts creeping in. And I think that's what a lot of the great mentors of mine have at least instilled in me. Like, hey, look, you know what? You're smart, but you're not that smart.
We interviewed Dr. Andrews, and you would think someone of his status and experience may think differently from what you said, but you're exactly right. He said the most important part in evaluating an athlete is not only getting the history and physical just from the athlete, but having their family in the room, maybe especially their mother, and speaking to them directly and being transparent and involving the whole family in the discussion. So even someone of his stature, who's treated some of the most famous athletes of all time and has revolutionized orthopedic sports medicine, he brings it back to the basics. So just like you said, you learned that from him. I've learned that from him. And it's our job to try to emulate people like him and move that forward. So I'm glad, again, it comes full circle with a lot of the guests we speak to, because just like you're incredibly experienced and involved, and you've learned from the best people. That's how you've gotten your position. So it's really refreshing to hear these credos over and over again.
Speaking of credos, I have the Andrews Institute credo card.
There it is.
And right here, number 1, patient philosophy. The patient is always right.
Yep.
Number 5, listen to the patient. Right? So he was, to speak to him was like for us.
And one of the ones that we use all the time in our sports medicine group is never be the first one to make the big statement. And that's a huge piece, because every young clinician wants to say, oh, this ligament is torn. This ligament needs Tommy John. We need to do this, that, and the other thing. And it's going to be 12 to 14 months. Well, okay, pause. Let's let.
I always tell therapists, when you're referring a patient to the doctor, don't tell them they need an MRI.
Yep. It's a big piece.
And don't tell them they need an x-ray to say, could you help me with this patient? They're not progressing. What's the best other intervention that you think might be appropriate?
Yeah, no doubt.
That's really good advice, Riz. I get patients in my clinic, and we're going off a little tangent here, but I'll get patients in my clinic. I'll say, how can I help you? How long has your shoulder been bothering you? What's going on with your elbow? And they say, I'm here for the MRI. I said, I need a little bit of history here. Like, how long has this been going on? What's been going on? And they say, well, you have all the notes. They sent you all the notes. You've read through all the notes. So I'm here for the MRI. You tell me what's wrong. And Riz, I think that's really smart. And Corey, you probably do the same thing with your athletes. So that's actually a really excellent piece of advice for clinicians.
Yeah. And it's unfortunate that our world, especially at the professional sport level, is we need an MRI scan on everything. And again, I'm not anti-MRI scans or any kind of diagnostics, because I do think they help paint a stronger picture of what's going on. But if I've heard it from Keith Meister once, I've heard it from him 1,000 times. It's you treat people, not pictures. And that's a big piece to it. But it's not everything. And I think we've gotten so accustomed to the snapshot in time that the MRI scan will give us that we just think that we can, crystal ball it from there. And again, the people, the athletes, the one thing that we love to say is that athletes will surprise us. They're master compensators. They're all these different things. And then we want to use this snapshot of a picture and say exactly what's going on with them. So yeah, I think it's definitely valuable to have as much information going into it. But that's the conversation we always have with our players. Like, look, hey, this is what the MRI scan shows. This is what the radiologist has reported. We never hold back information. We tell them exactly what it is. Now, with that being said, there's a lot of things that can happen on an MRI scan that are acute on chronic, more chronic in nature. There's a lot of changes that happen, especially for a thrower, the adaptations that happen there. So we explain all of that and we say, hey, look, this is just a piece of the puzzle, but we got to get you in front of the doctor or the surgeon or whomever that we feel is the most appropriate to go over the scan and then kind of take the next steps in your care.
It's great that you mentioned Dr. Meister, who I absolutely respect and admire. And you've been in the business for actually a few decades. And I'd love to hear you comment on how the treatment of certain baseball injuries, maybe specifically ulnar collateral ligament injuries of the elbow, such as Tommy John, at least surgical or operative management or second opinions, has really been shuttled to just a few main physicians across the country, Dr. Meister being one of these predominant or preeminent physicians. in the beginning or earlier, the team physicians for each MLB team would be able to offer their opinion and offer surgical intervention for some of these players. But with my work with the White Sox, any of our major league, or I would say the majority of our players, are getting second opinions with one of three physicians across the country. And we have absolutely fabulous staff in Chicago, Dr. Verma and the rest of the staff. They're world-class orthopedic surgeons. And, they're seeing their players go to Dr. Meister, Dr. Elatrash, or Dr. Ahmad in New York to be evaluated. So have you seen that change over time? And what is your thought about just a few physicians handling the majority of injuries from MLB players?
So I think the one thing I'll say, in a zoomed in view for, say, the Miami Marlins, we have a unique situation. Our head team physician, Dr. Mike Baraga, works out of the University of Miami. Unbelievable surgeon, knee surgeon. So he does all of our knees from top to bottom, from our front office all the way down to the Dominican. If there's a knee to be scoped and a knee to be repaired, that's our guy. He doesn't do elbows. So it changes the narrative for us a little bit because we don't have somebody in-house that does elbows for us. So the majority, if not all of ours, have to go outside. Now, to the shift of X amount of surgeons doing the majority and the lion's share of the surgeries, I think what ended up happening was there was a select few, and I think you named a few of them just now, that started kind of looking at the injuries the same way we're looking at players. If we're looking at players as evolving, if they're bigger, faster, stronger now than they ever have been, how can we continue to do the surgeries that we've done 30, 40, 50 years ago, right? I would say that most of the other joints in the body have made great strides over the years. Nobody has said that Dr. Anderson couldn't change his approach to foot and ankle surgery, which he did over the years. But to be honest with you, the way we were doing Tommy John surgery from the mid 70s with Dr. Job to where we were at up until 6, 7, 8 years ago, it's pretty standard across the board. There were slight things here and there. They went from a figure eight to a docking and some things here and there. But really, it was just a little bit of the technology probably shifted, and that's where it got to. It wasn't, I'm not sure it was driven by tear patterns or athlete demands and things along those lines, where I think that's where we're at now with a lot of our elbow surgeries and sometimes our shoulder surgeries too, that we're just seeing different tear patterns. We're seeing different mechanisms. The athletes, I just had a talk the other day with Dr. Meister about this, and athletes aren't feeling the pain in cocking and back at the beginning of the throw. They're seeing it out at ball release now, and it's more of a shearing eccentric kind of force that's being created. So I think even how the athlete is reporting the subjective of what's going on with their pain and when they feel it and all that kind of stuff, it's just changed. And why is that? Well, they're bigger, faster, stronger. Their forearms are stronger. They are gripping the ball tighter. Spin has never been more important. Velocity has never been more important. And again, you can't say that they're the villain here either, because they make for a great product. More spin on the ball, more velo on the ball. You know what? That's going to get a player paid more, and it's also going to make for a better product on the field that people want to see that. And it's really exciting, and it's really something that players are striving to get. So with that, those injuries are going to now change a little bit, and we've got to really evaluate how we're fixing them. And I think that's where the physicians that really kind of saw that early on and kind of took that leap of faith and kind of, stuck it out there and said, I'm going to try something new, even though we have really good success with a procedure for like 30, 40, 50 years almost. I think that's why you're seeing the gravitational pull to certain physicians now than ever before. And you're just seeing more of them. That's the other thing. Back in the day, it used to be like, I've heard from my old colleagues in the game that the National League doctor was Dr. Job and the American League doctor was Dr. Yoakum. So if you were a National League player and you were coming through LA, you saw Dr. Job. If you were American League and you're coming through LA, you saw Dr. Yoakum. Now it's kind of blown up a lot more. Dr. Andrews obviously took a bunch of cases, really prominent players, but I think that's been the difference, because it's not the same procedure. It's not the same outcomes. It's not the same volume that you're seeing that you are today. And that's why I think that there's probably more of that shift to just a certain amount of physicians.
So you talked about how the injury for Tommy John has changed, where it's more of a
Mhm.
shearing at ball release. Are you finding that the reason you did talk about bigger, stronger, faster athletes? Is there been a shift in them being more in tune to working on total body fitness,
Mhm.
more mobility of the lower half, more drive from their leg through and the cocking phase into the ball release, less external rotation may be needed if they're rotating their trunk more? Is it all of those things?
Yes.
Or are you finding that it's just velocity is the main determining factor?
Yeah, I think it's everything. I think we give way too much credit to the arm a lot of the time. I think we end up saying like, oh, we need to get shoulder strong or we got to get their forearm strong, and very important. But realistically, they're pretty small muscle groups that we're trying to put a lot of reward to. I think even from when I started in the game, the amount of use that we're seeing in the weight room and the how robust these players are being with their strength and conditioning programs. It's a year-round thing, and players are no longer having the mindset that, well, I just want to maintain during the season. No, guys are building still during the season, and I think that it's a dog-eat-dog world out there for pro sports. And if you want to be a guy in the big leagues right now, you've got to do certain things. So there are certain standards that you have to hold, and that's one of them. And yeah, I do think that we're having faster rotation. We're having stronger ground reaction forces from the drive leg and into we're understanding our biomechanics more and more, and guys are training to that. So the more information we get, the more we're probably being specific to what we can do and can't do to help a guy get bigger, faster, stronger. But that also does have risk and does have injury on the back end a lot of the time, and that's kind of what we're seeing.
Yeah, we had just interviewed Kurt Schilling, and we asked him what his best pitch was. And he said he can hit a gnat on the ass
Yep.
with a down and in fastball
Yep.
every day of the week.
Yep.
And he said velocity wins. So just talking to him being out of the game for as long as he's been, he's like, you don't have your Maddoxes anymore. You don't have your Glavins anymore. You don't have your Ryans anymore that could pitch 250 plus innings because they had finesse and could lay a pitch wherever they wanted. You have guys now that are trying to throw as hard as they can to beat these power hitters. So it sounds like that's the main thing that's happening right now is power and speed wins. And when you have that, the body doesn't like it.
Absolutely. Absolutely. I mean, I think that's the number one thing is that everybody's trying to, and it's not just the fastball, right? It's everybody's throwing, I mean, changeups there's guys throwing 93-mile-an-hour changeups, which makes no sense. That used to be a huge,
an 80 mile an hour pitch.
Yeah. And now we understand though that it's not so much the change in velocity, but also just the spin structure and all these different things that we can really leverage because we just know more. And that's great. But also to that end, but it is funny because I look around and I think I've got 3 on my 40-man roster that are on their back pitching after their second UCL reconstruction. So again, we're getting pretty good at fixing them a second time and getting them back a second time. So that's not even as big of a deterrent anymore that, if you get one Tommy John, it used to be that was what you got. You got one and hopefully it lasts you. Now it's, well, we'll just replace it after 5, 6, 7 years. And it used to be, oh, well, if we get 10 or 11 out of it, now it's, boy, if we get 10 or 11, that's a case study.
Well, you just opened the door to my favorite question to ask our people in baseball here. So we just interviewed Dr. Nick Rose, who's a hand and upper extremity surgeon in Southern California and consultant for the multiple Major League Baseball teams, NHL teams, NBA teams, etc. And we were talking about my favorite question, Shohei Ohtani, who is on his second Tommy John surgery. So he had a revision ulnar collateral ligament reconstruction and is arguably the best Major League Baseball player of all time. So what are your, as an experienced medical professional in Major League Baseball who works for a professional Major League Baseball team, what are your thoughts on Shohei Ohtani?
Oh, you said he's generational. He's, probably historical, past generational. I mean, it's impressive. I was actually around him during the WBC. We hosted a lot of the main pieces. I was kind of like the medical liaison for Major League Baseball, and I saw him up close and personal. And he's as advertised. I mean, he doesn't take anything serious. He seems very happy, smiley, and boy, if I had his talent, I'd probably be the same way. But yeah, I don't know how to explain that. And I think what we get caught up with when we see players like that, I know early in my career I did the same thing where I would see a player that was destined for the Hall of Fame and say, okay, everybody needs to be like that person. And they need to train like that person. And it's probably a fool's errand to try to do that because those athletes just are a little bit different. They're just built different. They recover different. They are special. They really are. So I think looking at it from my perspective, I mean, he's unbelievable. And I think I would just err anybody to say to try to be like Ohtani because I don't think you can be.
What are you guys doing with nutrition in the Marlins, and how are you focusing on function, wellness, and recovery focused on nutrition?
So with the Marlins, we have a very unique situation and relationship with our performance nutrition department. Gabe Kapler is our general manager. Gabe is a former player. Gabe came up through the Dodgers system as an executive, ran their minor league system. And one of the initiatives he did early on when he was with the Dodgers was really focused on nutrition. He's, if anybody, knows Gabe as a player or has seen him after the fact, if you just Google him and look at pictures of him, this guy takes care of himself, right? So
he's ripped.
Yes, he is. And so Gabe's focus on nutrition is second to none. So we have more support for our nutrition department than arguably anybody in baseball. And I would say it absolutely is than anybody in baseball. And when he was with the Dodgers, he started this idea that we were really going to hammer home nutrition. And everybody in baseball outside of the performance kind of areas thought it was crazy because they were spending a ton of money. It was like $2 million on nutrition for the minor leagues. What are the Dodgers doing? This is crazy. And everybody outside of that, in the performance space, strength and conditioning, medical, nutrition, we were all going, oh, this is awesome. I hope this catches on. And it did. And I think you're starting to see that across the board in baseball. The other sports are much better in that. They focus way more on strength conditioning and nutrition than we have, especially like in football, because you have to be bigger and stronger than the guy across the line from you. But for baseball, there's a lot of people that, for a lot of years went out and ate hot dogs and didn't lift and still were in the big leagues. But that's not the way the athletes are today. So Gabe, through his support and through his focus, has really created a robust nutrition department where we have a director of nutrition, we have assistant director of nutrition, we have dietitians at our affiliates. We have one that travels with the major league team at all times. And we really have a organic whole food type mentality. So if you come into the food room at Lone Depot, you won't see Uncrustables, you won't see candy, you won't see any of this kind of stuff. You will see things that are truly fuel for the player. And if players, have concern or challenges, it creates a stronger conversation to have. Why do you want this? Why do you want that? Oh, it's just because I want it. Well, all right, let's really dive into what you need to be the best version of yourself. And when you show how much you care in any of our spaces, but especially that, because it's such a comfort thing when things are going poorly or things aren't going well, you just revert back to things that make you happy. And food is one of those things for a lot of people, right? So really trying to explain why we're giving the options that we're giving, and our options are phenomenal. It's tough to look at the spread that we put out for our players and go like there's not an option for anybody, but it is going to have a strong focus, and that really comes from the top down. So I say this a lot about our front office, and it starts with Peter Bendix and Gabe Kapler and Brian Chad and Vinesh Kanthan. It's when we're looking at things and getting support. A lot of clubs give support to their support staff and to their performance staff, but there's a true understanding from our group. So it's not just support, it's support with understanding. And I think that's what a lot of teams miss, is having that ability to take risks, take leaps of faith, try things, try to make things better, pivot when needed, and it not look like a failure, look like it's a success because they understand what we're trying to accomplish.
I'm not sure I've looked at a picture of Gabe Kapler in 20 years since he was on the Red Sox. This guy is an absolute unit.
Yes, he is. And he's as intentional and amazing as a supervisor and boss as I've ever had. I mean, every conversation you have with him, it's like there's nothing else in the world that's important besides you and him talking in that moment. And the support we feel as a collective group is really, really special.
Well, Gabe, we look forward to having you on the podcast, and I can't wait to ask you about your gym routine and diet strategies.
Yeah.
And how your repaired Achilles is from when you tried the Red Sox.
That's right.
Since we're talking about nutrition, we know nutrition is a key component to recovery and performance. how does the advances of technology change the way that you're working in baseball, specifically rehabilitation?
Sure. So again, when a player gets hurt, it's not just, hey, we're going to sit down with the physical therapist or sit down with the athletic trainer and go over your program. It's, okay, performance nutrition, strength and conditioning, let's all get in a room. Let's all get on a Slack channel. Let's make sure that we're dialed in. What do we need to map out from here? How do we recheck if we're going to do an intervention? I think that's what also is a big piece to our success, is that if we're going to create an intervention, if we're going to create something to try to help a player, we want to make sure we test it on the back end. So if, for example, for nutrition, if we're going to do lab work and spring training and really hone in on vitamin D levels and feel like that's really important for health, really important for repairing of tissue, and especially like bone health as well. If we're going to care about that, a guy's low in that slot when we do their blood work in spring, and we intervene with whatever our supplement of choice is to get them up. If we're not retesting that, well, what are we doing it for? So I think that's a big piece to our process, is we've gone so strong into this criterion-based return to play or return to performance model that all of that comes into play. So if we're going to retest force plates and counter movement jumps, and we're going to retest shoulder strength with dynamometer, and we're going to look at those kind of things, then also we're going to do that in nutrition where we can look at markers and look at levels in lab work.
Since you're part of the hiring process for the Division of Sports Medicine, what qualities are you looking for when you're hiring athletic trainers or sports medicine staff?
Oh, it's a great question, and something that we care a lot about hiring in the Marlins, and I feel we do a really strong job of really fleshing out and knowing who we're bringing on board. But the number one thing is big engine. Give me a big engine, somebody that wants to be here, somebody that wants to work in baseball. Because again, you look at the pro sports for athletic trainers and physical therapists, there's a lot of levels to professional baseball. It's not just the Marlins, it's not just the Yankees. There's a lot of levels to the minor leagues, and it's not as glamorous. And, you're not on TV and you're not making a ton of money, and you're traveling with the players from this town to that town on a bus for 8 hours and eating in rest stops. So it's not glamorous. And if you want to do it, you better learn that you want to do it early. I always tell our interns and our young professionals in the sport, you got to learn to love it or learn to hate it, but do it quick. And because baseball is not for everybody. And I think that's the number one trait that I look for, is somebody that's got a huge engine. I can give them the tools through our staff of amazing clinicians to make them better as an athletic trainer or physical therapist. Very confident that we've got people that can make them better in their skills on the table. But I can't make someone come in with more energy. So to me, I'm looking for somebody that has drive, somebody that is looking to hit the ground running, be curious, ask a ton of questions, try to get better every single day, be a great teammate. Those are all the qualities I'm looking for. I used to care a lot about the letters after a name, and I think we all on this call have 15 of them a piece. But at the end of the day, if you can't come in and bring the energy and have a smile and want to try to get somebody better that day and create a relationship with the athlete, I don't think you're going to last very long in professional baseball. So my number one thing to any student out there or any young professional that wants to get into baseball or especially work on our staff is bring the energy, bring the engine every day.
That's a great answer. And Corey, I like warm weather, and Cam knows I have energy if you need anybody to help you out down there.
Big engine. Corey Tremble, big engine, behind the Sports Medicine podcast, big engine podcast.
That's right.
It's one of those things I try to tell students the same thing, and no matter where they're interviewing or going to work, it's understanding that the day is the day. Yep. It's not a clock in at 7, clock out at 3 or 8 to 4 or whatever you want to do. It's about building relationships. It's about doing what's best for the care that you're providing for your athletes. It's about going the extra mile, meeting the people to help collaborate with, just providing that environment that's best for you to learn. But knowing every day that when you wake up, there's something new, some new challenges, some new goals to meet, and some new mentors to hopefully find in your career. So that was definitely well said. You have to have the engine's a good one. I love it. Got to have the engine.
All right. Tell us about your role as the chair of the National Athletic Trainers Association Cannabis Task Force.
Sure. So a big passion of mine is cannabis education. And again, you throw that out there and you go, oh, wow, this guy must be pushing marijuana, or this guy must be an advocate for this. And couldn't be further from the case, because if somebody were to say you're the task force chair of the anabolic steroids task force for the NATA, nobody would think that I would be trying to give everybody anabolic steroids, right? So that's the first piece of information. But this all started for me back before COVID, when a lot of things changed for how we prescribe medications and how we do things. We would get players back from these doctors that we're sending them to all around the country, and you couldn't just phone in narcotics like a Norco or Percocet or something like that post-operatively, right? So they would have to prescribe a healthy amount on the way in, and we would have guys that would have meniscus repairs or resections, where all of a sudden you're going to get these guys back in a few weeks, but they're bringing back a bottle of 30 pain pills. And I said, this is probably not a good thing for our athletes, right? And I started looking at it and going, okay, well, what is this for? Why are we doing this? And more and more players started like looking at a more holistic way of taking care of their pain and managing their pain. And some of the cannabinoids that are out there, like CBD and CBN and CBG, really are showing some great runway to help that. Now, THC does in like certain areas, but also you got to weigh the risks of performance, which THC we know is not good for. So basically it all started with that, of looking at things through a different lens. And then the next step was Major League Baseball removed THC testing and marijuana testing from their drug panel right before the 2020 season. And they came out with really just in the middle of the night, they said they were changing that, and that was that. And there wasn't a lot of education. There's way more education than there is then now. But at the time, there really wasn't anybody talking about it. And it was just like, hey, we're making this change, I'll talk about it. And I just didn't feel that was the right way to go about it, and had a bunch of conversations with people at the commissioner's office who were super supportive and really great, like John Coyles, who I consider a strong, close friend of mine and mentor, that we really started looking at this and seeing how can we message this better for athletes. And that's what really stemmed all of that was, okay, we've made a change. Again, we need to do something with this change. And that's where the educational piece came from. And I had a great mentor in Jeff Conan, who is the head of our DAT program at FIU that I went through. And he's, consults with a ton of Power 4 schools and all this on intervention and ways of having marijuana cessation programs without just saying the say no to drugs, but it's meeting the player where they're at and saying like, look, I know you're using probably too much, and this is probably why we're seeing the issues you're having. You're losing the ball in the lights, your reaction times aren't as good. All of these different things that we know that THC can be detrimental for. So I think it stemmed from having the guts to kind of put myself out there and say, hey, look, we really do need to start looking at this and trying to find ways to help athletes navigate this without just a message of don't do it. Because when you test and you can suspend and you can punish for it, it's an easy conversation, right? And once that conversation shifted, well, we have to have a different conversation. So I think that's where that whole started for me. And then it was just, I dove in more and more and more, and had the opportunity to kind of create educational resources for athletic trainers. So when they have these conversations with their athletes at the college level or even at the high school level, they can really give some good information to them that's backed by science, that's backed by whatever research that we do have. It's not always great research in this space because it's still federally regulated as it is. But again, it's something that if we didn't talk about it, it would just continue to be a problem. And I think that's where the task force really stepped in and gave athletic trainers kind of a crash course in how to have this conversation with their athletes.
It's interesting. You talk about Jeff Conan. He was on the PBATS podcast. You were on the PBATS podcast. Brad Pearson was on the PBATS podcast, and then we were on the PBATS podcast.
Yeah, it's weird how it seems like these circles are starting to play together, aren't they?
It's all great. We're meeting some great people with all these. It's fantastic. So we know burnout's an issue in sports medicine, athletic training, orthopedics.
Yep.
How do you personally manage that, and how do you help your staff manage it over the season?
Well, I think the biggest shift and change with especially burnout and kind of the day-to-day for us athletic trainers and physical therapists is stop taking ourselves so seriously. That's number one. I think it's for so many times we felt that if we didn't spend the extra hour at work, that the organization was going to crumble and things were going to stop and we weren't going to be able to play a baseball game tonight if I didn't get in to work at 7 a.m. for a 7 p.m. game. And I think that was step one, was realizing like, look, you are important, you are valuable, but you're not important and you're not valuable if you aren't at your peak, aren't at your top, and you're just going through the motions to say that you had 4 meals at the ballpark. That's how long you were at the field, kind of thing. So I think that was number one. Number two is the support that we've started to see now especially in professional baseball from other areas of. It's not just the athletic trainer doing everything. Once upon a time, the athletic trainer was the one that packed the bus and did the rooming list and did all of these other non-medical pieces on the road. And we kind of given those up, and other people have taken on some of that load, and they've hired more in different roles. So I think that's another piece, but it's really the message from the top down. And again, our president is great with this. It's like, hey, look, you better not miss a birthday. You better not miss a graduation. These are things that are important to us as an organization to push that. And we will make up for it. It's if you need to take a weekend, take a weekend. We got you. And the more that you have that messaging of this is a team, this is not all about you, this is not all about me, that, hey, look, take the time. If you need, a few days off, or, hey, you want to go pick up your kids from work, like, go, we got you. And I think that that's one of the biggest pieces. And for me personally, I try to, and I'm not very good at it. My wife will tell you right now that I'm not great at disconnecting. My phone is always on. I'm always on my phone. I'm always scrolling through messages and all sorts of stuff. But I do try to get away from the game and get home more often. That's the one perk of this job, is that I can actually go home for a couple days here and there and try to do some family stuff and be really intentional. And again, it's the mark of bad leadership when you think that you have to do it all. And so, and again, you feel guilty at the start of delegating and asking others on your team to do things that you could very easily do, but that's how they're going to grow. So understanding that by giving tasks and giving responsibilities, giving ownership to things to your staff is really beneficial to not only the team and the group and the program and the process that you're creating, but it's good for everybody's mental health as well.
Yeah, I like how you just mentioned delegating, right? For 30 years, I did all the ordering, yep. And I wouldn't give it to anybody else because I felt like they would over-order, yep. or overspend, or be frivolous, right? And I then finally gave that up, and I'm like, wow, that's actually a pretty good relief. And the other side of it is I always tell the staff, I give you enough lead or enough rope to kind of choke yourself. And then if that happens, then we can step back and say, hey, how do we do this a little bit better? Mm-hmm. I think it's our mentality. I think us growing up, being in it for several decades, right? Yep. We always did, and that's what we did, and we enjoyed doing it. But now it's trying to get us to shift out of that mentality and helping our staff understand that it's okay. Like you said, if you need to go pick up your kids at school, or, go to a birthday party for, or a graduation party, you can get out and do that. Yeah. So I think that's an important message, especially for an organization. That's great. Where do you see sports medicine and baseball heading over the next 5 to 10 years?
Oh, I'm excited about where things are going. I really am. Unfortunately, I think we're going to get there because we have so many, our populations and our ends are so big right now with surgeries and injuries and things like that. So that's unfortunately not something that we love. But I do think we're going to start seeing the advances with a lot of our AI technologies really coming into play. It's not going to, and I know people are going to be like, oh, the AI is going to take our job. No, it's not. It's going to make our jobs better, I think, in a lot of ways. I think if we're able to utilize, like on the primary care, family medicine side, if we're able to do more real time, like ECGs on people and start looking at HRVs and things along those lines, I think that's where we're going to start seeing some real advances in sports medicine. I don't know if timelines are going to shift as far as like return to plays, but we are seeing advances in biologics, and we're seeing advances in things where if we are doing a surgery, we're doing it a better version of it. So it might last longer. So I think we're getting better at our objective measures and our objective data that we're pulling on the back end. And I know that workload management is like a topic for every sport and every athlete and all this kind of stuff. And I think we're getting closer to better on that. I don't think we're anywhere close. I think a lot of times just asking a player how they feel might give us the exact same answer of some of the data that we're collecting. But I do think ultimately long term, we're going to be able to really start monitoring better and more efficiently and more effectively and less invasively and less clunky than the way we do things now. And I think that will just give us a better readout of where athletes are on a day-to-day.
Yeah, I mean, I have a master's in applied sports science analytics. You said HRV, you said workload management, you said ECG, and I'm like, you're talking my talk. So I think, where do your players land there? Like, do they wear wearables? Do they want to wear them?
Sure.
Do you make them wear them? Like, where is that in the grand scheme of things?
So I'm a big stickler on anybody that says like always or never. So I'm not a big proponent on telling somebody they have to do something, but I am a big proponent on educating the hell out of something. So I think if you educate on a lot of these fringe entities and ideas that are starting to infiltrate our settings, I think if you educate them on how it helps them win more, how it helps them make more money, how it makes our team better, that's the goal, right? Our players are getting around to it more and more because a lot of the training facilities that they have out and about are utilizing them as well. So I think that there's more comfortability than there ever has been prior. And I think we're also doing a better job of utilizing this technology that we do have to not pull back activity like I think it was originally intended, or at least originally rolled out, that we were going to look at these things and control your workload. And that meant we were going to take you off the field or off the court. And I think that the shift in explaining to athletes that, hey, look, no, we're utilizing this to help give you more, give you a better opportunity to have success. I think that's shifted the conversation a little bit. But yeah, there's a lot of athletes that wear technology and to keep their information to themselves, which totally their prerogative and their ability. But I do think we're getting closer, because when we're returning players safely at a faster rate than we once were, because we're utilizing some of this, the buy-in gets stronger. So if all of a sudden we're utilizing GPS to understand that they are hitting top end speed already, or 95% max V, or whatever they're doing on their return, now we can show them, hey, look, you've already done this. Now there's a little bit more buy-in.
Yeah, well said. Well said. All right, here it is.
Lightning round.
The infamous lightning round.
Here we go.
Short question, short answers. What is the toughest part of the baseball season?
Travel.
That's a good short answer.
Flying coast to coast and playing the day that you fly. I mean, that's, to me, the most difficult thing. Football talks about travel being difficult, but they can go 2 days prior. You're traveling and you're playing the next day, and then you're traveling and playing the next day. So yeah, travel is by far
no days off.
No days off, and that's it. That's it.
One exercise every baseball athlete should master.
The squat. I think everybody thinks rotator cuff and forearm, but I'll tell you what, the squat is a pretty advantageous exercise for everybody if you're powerful in that, boy, you got a good chance of being powerful in a lot of things.
Front squat, hex bar, back squat.
I don't think that there's any specific that I would say one versus the other. I think it's best for that athlete, but definitely squat. I
should have said split squat too.
Yep. But and yeah, I mean, for baseball, we do a lot of single leg activities. So yeah, that's probably a better thing. But yeah, the squat pattern in general is be strong in the weight room, because a lot of guys don't want to squat. So if they are squatting, there's a good chance also that they're doing every other exercise that you want them to do.
What's your favorite road Major League Baseball city? Globe
Life in Texas. Easy. That's unbelievable. I was with the Rangers for a year, so I got to be around it a little bit. And then when I go there, the visiting clubhouse is amazing. One of my most important mentors in my career is Jamie Reed, a longtime head athletic trainer and senior vice president over there in medical. And Jamie was the one that really put together their training room and their hydrotherapy room, and really was behind a lot of it. And just the flow of it, how, like, on the home side, it goes right from the training room right down this little walkway into the dugout and back up, and the other side is the clubhouse. They did it right. It's crispy, it's clean, it's magazine worthy.
Most underrated recovery tool?
Sleep. 100% sleep. It's the
right.
cheapest, most important thing that we've got. Sleep, food is the number one or number two, but that hits your wallet. Sleep does not.
All you high school athletes listening, yes,
Yeah.
sleep.
Don't worry about the blow up boots and the things that make your arm juice around. At the end of the day, go take more naps.
Yeah. All the shiny stuff doesn't matter.
That's right.
One word that describes the life of an athletic trainer in professional baseball.
Rewarding.
Like it.
Yep, by far rewarding. Everything I've had in my life, including meeting my wife, has come directly from working in professional baseball. So, yep, rewarding.
One piece of advice every young athletic trainer should hear.
Don't sweat the small stuff and control what you can control. Don't worry about the stuff that's out there that you can't control. Control the controllables. I tell that to our staff all the time. You can't control the injury, but you can control what we're doing with that injury once it happens. So control what you can control.
Well said.
What do you think of Marlins, man?
You know what? I haven't met him. I love it. I wish you would go with the new uni though, because we've got some pretty cool uniforms now. We went back to the old teals, and we've got a great City Connect. So I wish maybe we'll have to get him some new gear. But yeah, I love it because people know. You know, when I say, yeah, I'm the medical director for the Marlins, they go, oh, like that dude that sits behind home plate in the World Series. I'm like, yep, that's it. There it is.
So, all right. So to close out today, Corey, what's one message you'd like listeners, whether they're clinicians, coaches, athletes, or students, to take away from this conversation? Sure.
I think the biggest thing, and I talk about this all the time because it's one of the things that if I don't keep talking about it and remind myself about it, that I know that I'm going to fall back into a more egotistical mentality. But the biggest ability you have is vulnerability. I think that's one of the things that all clinicians out there need to understand. It's a superpower. Be vulnerable, be understanding that you don't have all the answers, but you're going to work hard to find those answers. Understand that this journey that we're on as sports medicine clinicians, that medicine is an art and we practice it, and that this is nothing that's set in stone ever. And it's okay to say you're wrong, and to understand that failure is just part of the road to success. It's not the opposite of success. So all of those things kind of encompassing of being vulnerable and allowing yourself to be humble, keep your ego at bay, and really look at the situation at hand and kind of move forward from there.
That was great. Well, Corey, we sincerely appreciate your time today. We hope this conversation resonates with our listeners and with our peers and colleagues, and we hope to continue the conversation soon.
No, thank you guys. It was a great time, and really loved taking this time to talk with you.
You're the man, Corey.
Thanks, Corey.
Thanks for listening to Behind the Sports Medicine Podcast. Follow us on social media and check out our website.
The information shared on this podcast is for educational and informational purposes only and is not intended as medical advice. Please consult a licensed healthcare provider for guidance related to your specific situation. We'll see you next week.